Absolutely, Aditya. Thank you so much for joining us on the broadcast, sharing all those details with us. We're going to leave it there and shift our focus to some breaking news coming in with regards to COVID, where 5 new COVID cases have been found in Noida, Uttar Pradesh, with the total number reaching 62. That's the development that we are tracking at this point of time. My colleague Akram Khan joins us on the broadcast to give us more on this. Akram, what more can you tell us at this point of time? We are learning that 5 new COVID cases have now been reported from Noida.
देखिए सामने अगर गौतम बुद्ध नगर की पूरी बात की जाए तो शनिवार तक टोटल 57 मरीज थे, जिसमें जो मरीज थे 30 पुरुष थे और 27 महिलाएं शामिल थी। लेकिन 24 घंटे के अंदर ही 5 नए केसेस आए हैं, जिसके बाद इसकी संख्या 62 यानी कि 62 हो गई है। और लगातार जो कोरोना पॉजिटिव मिलने की सिलसिला जो जारी है और कोरोना जो है वो तेजी से पैर पसार रहा है। पूरे उत्तर प्रदेश की अगर बात करें तो बड़ी संख्या में जो कोरोना पॉजिटिव मरीज है वो निकलकर सामने आ रहे हैं। इसके अलावा जो मेरठ, कानपुर, आगरा जो अलग अलग जिले हैं वहाँ मॉनिटरिंग भी किया जा रहा है। और अगर गौतम बुद्ध नगर की बात करें तो यहाँ के जो नोडल अधिकारी हैं इसकी कोरोना के, टिकन सिंह, उन्होंने कहा है कि कोरोना के जो लक्षण मिले हैं वो कॉमन कफ और कोल्ड के लक्षण हैं। अभी तक जिले में कोई गंभीर जो केस है वो सामने नहीं आया, लेकिन जिस तरह से तेजी से मरीज बढ़ रहे हैं वो एक चिंता का विषय है। इसके अलावा स्वास्थ्य विभाग की तरफ से लगातार मॉनिटरिंग की जा रही है और आइसोलेशन में जो लोग हैं उनसे भी परिवार से उनके से कॉन्टेक्ट कर उनकी जो मरीजों की कॉन्टेक्ट ट्रेसिंग है और ट्रेवलिंग हिस्ट्री है उसको जुटाई जा रही है। इसके साथ ही जिला प्रशासन की तरफ से भी जो प्लांट हैं ऑक्सीजन के, जैसा हमने पिछले कोविड की लहर में देखा था तो उसके बड़ी दिक्कत सामने आई थी, तो उसको देखते हुए अब जो ऑक्सीजन प्लांट है लगातार जिला प्रशासन की टीम उसके अभी निरीक्षण कर रही है कि कौन कौन सा प्लांट चालू की स्थिति में है और कौन बंद पड़े हुए हैं। तो इस सब को लेकर जो स्वास्थ्य विभाग है वो बेहद अलर्ट स्तर पर है। लेकिन लगातार गौतम बुद्ध नगर में जो कोरोना की मरीज है वो सामने आ रहे हैं। और देखिए, जो जीनोम सीक्वेंस की बात की जा रही है, निजी अस्पतालों में जो संक्रमित मरीज हैं उनके नमूने भी मंगाए जा रहे हैं। इसके अलावा जो कोरोना मरीजों के संपर्क में लोग आए हुए हैं और जो सिस्टम में नहीं पहुंच पाए हैं उनकी स्थिति भी जांच की जा रही है। इसके अलावा लगातार दिल्ली एनसीआर के इलाकों में ट्रेवलिंग हिस्ट्री जो है लोगों की वो भी खंगाली जा रही है। तो कुल मिलाकर जो 24 घंटे में जो 5 नए केस आए हैं वो चिंता का सबब जरूर है। हालांकि माइल्ड कोरोना पॉजिटिव के लक्षण है, लेकिन जिस तरह से तेजी से कोरोना पैर पसार रहा है देश भर में उससे लोगों में जरूर हड़कंप बचा हुआ है। स्वास्थ्य विभाग कह रहा है लगातार कि पैनिक होने की स्थिति नहीं है। होम आइसोलेशन और लगातार जो उनकी दवाई है उसके ट्रीटमेंट के लिए जिला प्रशासन की तरफ से टीम लगाई जा रही है। लेकिन अब तक गौतम बुद्ध नगर में 62 कोरोना के मरीज पॉजिटिव मरीज पाए गए जी।
Thanks, Akram, for joining us and sharing all those details. Meanwhile, my colleague Brian Thomas has spoken to Dr. Sandeep Nair, who is a Principal Director and HOD Chest and Respiratory Disease at the Max Super Speciality Hospital. Take a listen.
Well, there has been a sudden spike in the COVID cases in India. In India itself, there has been more than 3,000 cases that is prevalent at this point of time. Now, talking about the national capital, that national capital has also seen more than 300 cases till now itself that has been there. Even though the recovery rate also has been about 52 and one death has also been reported in the national capital. And if we talk about the data itself, Kerala is the most affected region that is jolting with COVID cases. And to talk more about it, we are joined by Dr. Sandeep Nair, who is the Principal Director and HOD of Chest and Respiratory Diseases, BL Kapoor, Max Super Speciality Hospital. Sir, welcome to NewsX. So my very first question to you would be, is COVID back? Was it always there, or it has, because we've seen a surge now, was it always there, or it has come back, it has made a re-entry?
See, COVID had never gone actually. It had been in a very low profile throughout the community. Of course, there were different waves. We had alpha wave, delta wave, and Omicron waves, and so on. But it has become some endemic. It has been little bit, we'll see some sporadic cases, and they were taken care of. So there was some COVID always there, because it's just like a flu-like symptom, and you were not testing all the people, so you don't know that whether it's been COVID or some other. And most of them just require a conservative treatment. You don't need any aggressive treatment for the same. And now a sudden surge in the cases, of course, started more in the Indonesia, Malaysia, Singapore places, and now in India. Maximum is in Kerala, more than 1,000 cases, and now we've crossed 3,000 cases in India. So, of course, there has been some surge, but we are nothing to panic, but definitely to take all the precautions.
And what are the variants that is doing rounds? If we talk about the COVID, what kind of variants are there?
So this is just Omicron variant GN1, which is prevalent now. It's a subvariant of Omicron variety. That was the last wave which we saw it in 22, and they are the ones who are prevalent out here in most of the places.
And also the data says that it's more than 3,000 cases in India. Do you, as a doctor itself, because there are many viewers who are watching you on right now, is there a sense of panic? Is there a sense of fear among people? Should there be a fear or panic among people? What would you advise to the viewers itself?
So my request to each and every one of the viewers is that please take precautions, but do not panic. The patients are getting sicker only those who had a comorbid condition. Those who were immunocompetent, those who didn't had any problems were absolutely fine and have been taking care of the disease at home only. Only those immunocompromised, they should take precautions, wear a mask. That's COVID protocol, wearing a mask, social distancing and hand hygiene, that's very important. And I know by the time we are all vaccinated and that's been taken care of, but please take precautions.
And what kind of symptoms are we looking at? Because in the year 2020, it was loss of smell and there were other prevalent factors. But if we talk about 2025, what are the major symptoms that is doing the rounds?
Yes, in the past we had seen, more of extrapulmonary symptoms, more of the symptom outside the lungs, like loss of smell and loss of taste, and of course even a lot of GI symptom which we saw it. This time we are seeing mainly respiratory symptoms. Patients are having cough and breathlessness, high-grade fever, some respiratory little bit of distress. Most of them patients are not having low oxygen unless they are having some comorbid condition. Most of them are being just like another flu-like symptoms.
And again, what are the do's and don'ts the people, the public should do and should not do?
So again, like I said, COVID protocol, the three things which you always remember: social distancing, mask and hand hygiene should always be there. Whether there is a COVID or not, always do that. And I request to anyone who is suffering from the symptoms, it may or may not be COVID, but even a normal flu, please isolate yourself, please protect others to get infected. Just keep a distance, wear a mask so that others don't get infected. Even if it's not COVID, even for flu, the precautions remain the same. And don't go into the crowded places, especially those who have got a low immunity. Don't go to the crowded places or outside too much. Try to stay at home and prevent yourself to getting the infection from the COVID.
And Dr. Sandeep, one last message as a doctor you would want to give our viewers.
Do not panic, but do take all the precautions. This is always consult your physician if you have these symptoms, because it's better than sorry. Because if you go to the doctor initially and you know that you're suffering from a particular infection, then the precautions always remain the best.
Thank you so much, Dr. Sandeep, for speaking to us. So yes, viewers, that was Dr. Sandeep Nair, who spoke to us exclusively for NewsX and said what are the do's and don'ts, what one should be doing at this point of time. And he also said that yes, the people, the public, the viewers should not panic, but remain vigilant and visit the nearest hospitals or clinics to make sure that they are in a safer position. This is me, Branandi Thomas, signing off with camera person Sudhir for NewsX, Delhi.
All right, we have some breaking news coming in where a demolition drive started in